Hi, welcome to this week's Mental Health Monday. Today's subject is going to be caregiver burnout, what it is, and how to cope. And we're here with the mental health and wellness peer educators, which I am one of. My name's Alia Jessup, and we also have B. Ryan with us.
Yes, I am B. Ryan. That's all. But okay, we can go into the outline. This is just a quick kind of outline of what it'll look like. So we're going to talk about the definitions of caregiver burnout, what it looks like when it happens, where it comes from, why it's so prevalent, kind of to take a look at if you are suffering from caregiver burnout and some ways to cope with that. I don't know why that had any animation. Anyway.
So first off, let's start with what is defining it? What is caregiver burnout? Well, if we kind of look at the Cleveland Clinic, they define it as a state of physical, emotional, mental, and even financial exhaustion, so a toll on you, as a result of ongoing and intensive care for a relative, friend, or spouse. This is when the attitudes towards caring shifts from positive and gratifying to negative and exhausting. It is associated with heightened levels of guilt, anxiety, depression, fatigue, and stress, and also just like a physical weariness.
Yeah, for sure. And something, this might be a term that you haven't heard before. I know, even I was in a caregiver role kind of my whole life, and even I did not have the term for this, but you might, it might be a little more prevalent than you realize, especially with the pandemic and rising care needs. So we wanted to play this little about 2 to 3 minute video about how much is on the rise since 2020. So let me make sure that my sound is being shared as well.
It's very overwhelming.
Elise Hill has spent the entire pandemic juggling her work, caring for her toddler, and house chores.
I have to work during his nap times or when he's sleeping.
The Ontario mom was at the tail end of her 18-month mat leave when the pandemic began.
I made the decision, along with my husband, that I would, while working from home, also care for my son because we weren't comfortable putting him in daycare. And that choice has definitely been challenging.
She says lockdown mandates and distancing from family, friends, and other kids has made caregiving more difficult.
It's a lot, and that really contributes to caregiver burnout, which I've definitely experienced personally.
Clinical psychologist Dasla Milani Virgi says caregiver burnout has been more evident during the pandemic.
Caregiver burnout has been extremely real for so many people. It's those multiple demands, but it's that emotional need to take care of others.
Many people associate caregivers as healthcare workers or people who take care of those who are ill.
We can also talk about it in terms of teachers. We can talk about it in terms of support workers, the folks who are at home who aren't necessarily even taking care of an ill family member, but simply family members who require care.
Alani Virgi says caregivers often feel burnout when they're stretched beyond their capacity.
When our empathy, our desire to help, and our need to take care of other people is the thing that is exhausting us and the thing that is stretching our capacity to the point where it can't stretch anymore.
Christiana Aggie, Executive Director of Alexis Lodge Retirement Residence, a memory care facility in Ontario, has been working with dementia and Alzheimer's patients and their caregivers for 23 years. She says it's important for caregivers to take a step back and evaluate their own health.
Be tuned into the signs and symptoms of caregiver burnout, because a lot of people don't even know it's happening. They become so irritable, they become fatigued, even to the point of depression.
Part of Aggie's job includes offering education and awareness to caregivers to help them avoid burnout and exercise self-care. Tips she says every kind of caregiver can benefit from.
When you are depleted and you have nothing else to give, you both suffer. It's important that caregivers reach out for help. Take mental health breaks, at least 20 minutes a day. Be away from that environment. Healthy eating, adequate sleep, exercise is really important. It's good to look for resources out there in the community.
And finally, she recommends caregivers go easy on themselves.
Caregiver guilt is really difficult to handle because you don't think you are doing enough.
Sharmeen Samani, Global News.
Okay, so that was kind of a short introduction to caregiver burnout. And something that they didn't say specifically, but you could kind of gather is that caregiver burnout can happen to anyone who provides care, but mostly happens to unpaid, unprofessional family members. So these are people who have never had to provide care before. New mothers might be an example that comes to mind, or if your spouse has fallen ill might be another thing that comes to mind, and you've never had to care for someone on a medical or very intimate level like that before, that you're kind of thrust into that role. And we'll talk more about that a little later down the slides. No, there we go.
So we're also thinking about like, where does it come from? It's when you're caring for anybody. It could even be a pet, just someone who is under your care and is relying on you. And the level, durations, we're thinking time, we're thinking type. So what kind of care are you providing? Is it physical? Is it that you need to provide medication or emotional toll? Amount and cost of care becomes overwhelming and fatiguing.
And as far as what it looks like on the caregiver, now this is never to dismiss the person who's being cared for, never to dismiss their struggles as well, because of course they are obviously struggling, but the caregiver can suffer emotional, physical, and financial problems as a result of providing that prolonged, intense, intimate care. And so as far as emotional, you see you're withdrawing from friends, you lose interest in things that used to bring you pleasure, you feel down. Pardon my brother in the background, feeling down, irritable, helpless, angry, guilty, you have increased anxiety, stress, you are exhausted. Physical symptoms, you are gaining or losing weight from eating too much or eating too little. You're sleeping too much or sleeping too little. You're more prone to getting sick, catching colds. You are crying more often, and you experience physical soreness. Now, whether this be from the stress manifesting with physical symptoms or just the soreness of having to care for someone that has a lot of physical needs. You might notice that a lot of these symptoms line up with the symptoms of depression. They do kind of not comorbid, but they kind of line up in that way because the stress from having a situation like this can cause people to fall into depressive episodes, along with the financial aspect of caregiver burnout, which is some types of care requires a lot of money, which many people don't have, especially if you're unexpectedly thrown into that caregiver role. So you're selling things to pay for bills. You are sacrificing bills to pay for current needs. So like you're late on your phone, you're late on your cable, your rent, you have increased care costs, you are missing work to care for someone, and that leads to lost income, and you have those increased medical costs, say for doctor's appointments, medications that aren't covered if the person you're caring for has specialized care, and things like that.
And so we're also looking about kind of why do we experience caregiver burnout? Where does it come from? So it can come from many different things, and one of them is role confusion. Sometimes it can be hard to separate between the role as a caregiver and the role as the spouse, the friend, or child or parent. And it's confusing to kind of suddenly be in a caregiver role when you're not expecting it. You also have unrealistic expectations. The expected result of your care doesn't line up with the reality. Sometimes you want to give all you can give all you can give, and you just don't have the amount of time or the amount of empathy at that moment. And once you start caregiving, sometimes it's hard to stop. Maybe you can't turn off your brain and you're always thinking about what you can do better, or maybe you don't have respite, that there is no one else to do the caregiving, that it is all on you, so you can't stop.
And there are a few other reasons. So lack of control, this is a big one, is that most caregivers are not professionals. They have no nursing training, they have no schooling. They are kind of just put into this caregiver role and have to teach themselves as they are caring, and, lacking money and resources and skills to properly care for their loved ones. So just a little bit of experience, my dad had multiple sclerosis. That was the care that we were giving, and he was on all these different complicated machines. We had to perform these procedures daily that I had to learn very early as a kid, that obviously if, you know, your parent doesn't have anything like this, you would never learn, you would never have to learn. So it's kind of having to teach yourself these things that only medical professionals would know and are paid to know. But since you are in a caregiver role, you kind of have to learn that yourself. And unreasonable demands, this can be from the caregiver side. So you are putting undue responsibility on yourself. Like Alia just said, you think there is no one else. You put it all on yourself. It has to be you. You are the one who knows, or maybe you don't trust anyone yet. Like you don't have that trust in you, or the person being cared for puts too much responsibility on you. So this could be for spouses, for family members, for grandparents, you know, who are thinking, you know, you're young, you can do everything, when you can't always, you need help. And then another important one is you may not even realize you're in a burnout period. You may just be pushing, and not even realize that you need to take a break.
So why is caregiver burnout so prevalent? Well, nearly 44 million, and that's about 1 in 5 Americans, are unpaid, unprofessional caregivers caring for a family member, friend, spouse, or child. 40 million of which provide care to adult loved ones with disabilities and chronic complex medical issues. And I also want to point out that we also have the issue of a kind of a sandwich generation starting, where we have middle-aged Americans who have older parents or older generations that are relying for their help, but they also might have young children that rely on their help as well. And so they're kind of sandwiched in by this generational need to provide care.
Yes, that's a really good point too. That's something you don't really think about as well, especially if you are planning to have children. And so just some more reasons, you know, lack of financial resources, lack of planning, lack of foresight. You know, obviously you might be able to see some signs early on, but you can never really plan for the kinds of needs and illnesses and disabilities and care that your loved one might need. You know, lack of knowledge, we touched on that, lack of support, respite, lack of proper care facilities. Sometimes we simply do not have access to those really nice medical homes, nursing homes, day clinics, or sometimes they're simply too expensive. And lack of family support. Sometimes we just do not have family members that are able and willing to assist you, even if you really, really need it.
And I'll also throw out there, maybe you're also lacking physically. It's maybe hard physically to care if you're, let's say, helping someone bathe. You can't pick them up or easily maneuver them. So there are you can also have physical limitations. And to kind of also move on, do you have caregiver burnout? Well, let's kind of go through and think about kind of what are the ways you're kind of feeling the symptoms you may be having. If you no longer find things pleasurable, and if your friends and family express concerns about you, maybe take note of that if the people closest to you are worried about you. If you feel like you're only getting negative feedback at work and you're having problems with your spouse, there seems to just be a lot of friction in your life. If you experience intense and recurring feelings of anger, sadness, worry, or fear, and maybe you go between all of those. You have difficulty concentrating because you may just have a lot on your mind. You have trouble sleeping, and you may have drastic weight changes or unexplained health problems that are becoming apparent. And maybe you're using substances to cope with and manage or suppress painful feelings or just the daily grind of having to be a caregiver.
So there are a couple ways to cope, and it's being a caregiver is in a very tough position, and you often hear people saying that they feel stuck. Like, I don't know how to continue because they continue to need this care, so I don't know what to do. So there are a couple things that that you can do, and is to know what caregiver burnout is and what the signs are, so you can see if you yourself are starting to suffer for it. Another thing is support is, again, we talked about putting all that responsibility on yourself. You don't have to do that. So don't be afraid to reach out to people around you. Let them know that you are struggling. You know, admitting that you are struggling and suffering from caregiver burnout does not mean that you begrudge giving the care. It does not mean that you do not want to provide the care. It just means that you are physically, emotionally in need of some assistance, and rely on community. There are websites around that offer caregiver respite in the community and community resources. I know there's some lovely resources in Detroit, specifically for caregiver burnout. There's, you know, and they're not really advertised because, again, many people don't know caregiver burnout even exists, even though so many people in the country right now are providing care to someone. And again, learn is, if you are experiencing having to give care with something you've never dealt with, do the research, learn about what you're doing, learn about the care you're providing so that you're not going in blind, that you can know what to expect, essentially.
So thank you for watching and listening to us talk about caregiver burnout. If you are a U of M student and you're kind of in need and you want to kind of talk about this more, or something else is going on, feel free to reach out to Counseling and Psychological Services, CAPS, and they're located on the second floor of the University Center. Their phone number and email are on the slides right here, and also the after hours crisis line, which you can reach outside of business hours. So thank you and have a nice day.